Hey, what's up, guys? Hope everybody's doing well. Today I'm going to talk about a rehab plan that you would do with a female cross-country runner with medial tibial stress syndrome, or MTSS. So MTSS is an overuse injury that causes pain in the lower leg, more specifically on the medial tibia, and has multiple risk factors that includes improper running technique, improper footwear, increasing training volume and intensity too quickly, tight plantar flexors that cause limited dorsiflexion, and weak and imbalanced musculature of the lower extremity. Two time-based measurable goals include increasing their dorsiflexion to 20 to 25 degrees within 1 to 2 weeks and decreasing their pain scale within 1 to 2 weeks. Maintaining cardiorespiratory fitness is important for any athlete, especially a cross-country runner. Obviously, we don't want them running because this is what caused the injury in the first place, so using a stationary bike or if you have access to a pool is a great alternative.
Tight plantar flexors can limit dorsiflexion range of motion, so stretching the gastrocnemius and soleus is important. This can be done by doing calf stretch with the knee straight and with the knee bent. Four-way ankles are a great way to work the extrinsic muscles of the lower leg. The muscles of the lower leg are responsible for balance, producing force for push-off, and shock absorption during running. Increasing resistance and reps is one way to progress this exercise. Stretching the gastroc and soleus is important. Strengthening these muscles is also necessary. These muscles are responsible for producing force and absorbing shock during running. If these muscles are weak and fatigue easily, the impact from running can be transferred to the bones, causing stress on the bones. This exercise can be progressed by going on one leg or doing them on an elevated surface. Working the intrinsic muscles of the foot is also important when treating MTSS, and this can be done by using towel crunches. To progress this exercise, you can add a weight on the towel. Pickups on a pillow is a great way to work on neuromuscular control of the lower extremity. You can have the patient start with these exercises on flat ground and then progress by adding a foam pad or a pillow. Adding more cups is another way to progress this exercise. Bicycles are a great core exercise. Have the patient pause for a few seconds between each rep to make this exercise more challenging. Increasing the number of reps is a way you could progress this exercise. Once your short-term goals are met, you can have the patient run on a treadmill at 6 to 8 miles per hour for 1 to 2 miles. If they can do this with no pain, then the patient should be ready to return to play. If you want to ease them back into activity, you can start them off with half a mile and then increase by half a mile each day until you reach 2 miles. The patient is ready for return to play once they are pain-free and have full dorsiflexion. The time frame for this injury is about 2 to 4 weeks. Dr. Lolden and Martin Delfino conducted a study on the Foot and Ankle Specialist Journal on the efficacy of foot orthotics and calf stretching on MTSS. After 3 weeks, a majority of the participants showed a 50% reduction in pain, showing that stretching the gastroc and soleus and wearing foot orthotics may be an effective treatment for MTSS. The Lower Extremity Functional Scale is an outcome measure that can be used for MTSS. They ask 20 questions on activities of daily living using a 0 to 4 scale. Lower scores indicate more intense symptoms of lower extremity injuries. The minimally important clinical difference is a 9-point change in score. There are 3 questions about symptoms during running.
So that concludes my rehab presentation on medial tibial stress syndrome. I hope you guys learned a lot and have a great day.